Hi, it's Brain Bites with me, Dr. B. Anxious clients and therapy's not enough? That's great, because this is part of a 3-video series that covers your client's experience of anxiety, aligning their goals and expectations for treatment, and figuring out how to get the right fit, which is what this video is all about. Then, in a separate video, I'll discuss actual medication options: PRNs, SSRIs, SNRIs, Buspar, or combinations, and details about each category and choice. Finally, I'll go over case examples from my own archive, discussing kinds of anxiety and various treatment trajectories, changes, and results with different types of medication regimens in another video. Let's dig in. What can you do when therapy just isn't cutting it for someone, or they're experiencing way more anxiety than they can handle right now? Sometimes it takes more than therapy alone, and that's where a prescriber like me can swoop in to help with various medication options. But how do you know what I'll pick so that you can prep your client? How can you ensure they tell their prescriber the right things so they can get the best treatment fit? I'm going to provide different areas that can be addressed to figure out what we need to target and how we can best get there. These different topics will cover different points based on a person's symptoms, treatment goals, and abilities and limitations of the different medication options, and how to have the discussion with their prescriber. Feel confident explaining the medication treatment options and who they'll work best for. Let's start off with your client's experience of anxiety. Do they understand what's going on with their anxiety? Are they making it clear to you? Anxiety shows up in a lot of unique ways in different people, with experiences ranging from physical symptoms to mental and emotional distress, and often a combination of both. Being able to recognize these variations is super important for helping people choose effective treatment strategies. And understanding the nuances of anxiety can significantly enhance your therapeutic approach, with or without medications. So let's talk a little bit about the physical symptoms of anxiety. Panic attacks are a good example. A few minutes of very intense physical symptoms that could include increased heart rate, sweating, shaking, upset stomach or stomach tightness, shortness of breath, feeling dizzy or having tunnel vision. Then there's the feeling of needing to get away or the impending sense of doom. Most of the symptoms of a panic attack are physical, and many people experience a lot of physical sensations when they're anxious. They can include any of those I've just listed, or other physical experiences that seem to be linked to anxiety, like muscle tension or fatigue, whether acute or chronic. These physical symptoms could easily be misinterpreted or overlooked, and many of my patients are surprised to find that these symptoms are often part of anxiety and not due to a separate medical condition. But of course, we want to make sure we're not missing something medical. It's a big part of my screenings. But the majority of the time, it's anxiety related. Mental or emotional symptoms like persistent worry or irrational fears need their own therapeutic focus. There's so much energy lost with chronic worry, and anxiety that spirals out of control or always drags someone to the worst possibilities in their mind. And sometimes there are no physical symptoms to see or experience, but their anxiety is off the charts. For some people, they may get panicky with or without a trigger. For others, it's that low level, that constant poking anxiety that their brain never gets a rest from. There are people who start out okay, and then their anxiety spirals out of control. And those whose brains always jump straight to the worst case scenario, no matter what. But what about clients who experience both physical and emotional symptoms? Ignoring the fact that these sometimes go hand in hand will lead to less than stellar treatment results. Maybe someone gets medication for physical symptoms, but still struggles with anxious thoughts. Or by only addressing the mental aspect, someone may end up in a cycle of worsening anxiety fed by unmanaged physical symptoms. By addressing the full spectrum of anxiety experiences, the treatment plan will better cover all aspects of discomfort that these anxious symptoms cause. Understanding the nature of how your clients experience anxiety will lead to more effective treatment and better results, especially when medications are added to the mix. What about your clients' treatment goals or expectations they have surrounding taking medications, about their anxiety, or other mental health conditions? Clients' treatment goals for anxiety medication can vary widely, with some people seeking long-term solutions and others wanting as little medication as possible. As a therapist, it's essential to help clients align various treatment strategies with their individual goals. This helps guide them towards a plan that they can feel good about, but that will also be effective. And we know if people believe something will help them, it often will. Balancing effectiveness and client preferences can be complicated, but rewarding, especially when you feel more comfortable discussing the options. Clients who have long-standing anxiety may be okay with the idea of taking medications for a while, maybe even years, to maintain stability and better quality of life with a lower level of anxiety. They may be willing to accept the potential side effects for the benefit of fewer symptoms overall. On the other hand, clients preferring minimal medication might fear needing it more and more or finding side effects too problematic, looking for other options instead. And that may be why they started with therapy and not meds in the first place. They may really hate the idea of medication, except as a last resort. Or maybe they just don't want to rely on a pill. And is this new anxiety? Is there a specific situation that's likely to be alleviated sometime soon, and they just need to make it over that hurdle? Or are we talking chronic or worsening anxiety that's been ongoing for years? The time frame and how pervasive symptoms are throughout their lives can make a big difference in treatment choice and response. This can also create tension if they experience severe anxiety but are reluctant to use medication. For instance, a client who wants minimal medication might struggle more intensely during high-stress periods, and their daily functioning can worsen. There are med treatment plans that can work pretty well for most people, but there's usually some time and flexibility required. By aligning treatment plans with clients' goals and expectations for medication, you build trust and boost the effects of the meds, and ultimately the therapy. Person-specific plans will lead to more effective anxiety management and greater overall success. Next, let's explore the medication options available for treating anxiety. But I'm not going to get into medication specifics right now because I discussed this in a separate video. There are quite a few different medication options for treating anxiety, each with its own schedule and benefits. These include as-needed or PRN medications, daily SSRIs or SNRIs, which are serotonin reuptake inhibitors, and Buspar or Busparone, which also acts on serotonin and is taken twice daily. Understanding these options allows you to discuss more personalized options with your clients. Then they'll be better equipped to have an informed discussion with their prescriber about what seems like it could be a good fit. PRN medications are generally just taken when needed and within the dosing parameters. They're supposed to provide quick relief for acute or overwhelming anxiety, making them ideal for clients with intermittent symptoms or specific anxiety triggers. They're often able to be taken a couple of times per day, and the side effects vary based on the type of medication prescribed. But they might also not be enough for people with chronic or persistent anxiety. Common PRN examples are Xanax, hydroxyzine, and propranolol. SSRIs or SNRIs, which are antidepressant anti-anxiety medications, are taken daily and can provide more consistent symptom management. But these meds can take weeks to become effective. Clients may also experience initial side effects which can cause increased anxiety about taking medication. But for a longer-term picture with more chronic anxiety, these are a great answer and can be very effective. Buspar or Busparone is a medication specifically for treating anxiety and is taken twice daily. It's another option that can manage anxiety without some of the side effects associated with SSRIs, but it requires that someone remember to take medications 2 times every day, which is not an easy thing for many people. But for the right person, this medication can be a perfect fit. The variety of options can be overwhelming for clients trying to decide the best choice for their treatment. Providing clear, tailored information about these medication options helps clients make informed decisions that align with their treatment goals and lifestyles, and hopefully provide a big benefit for them in therapy sessions as well. Don't forget to teach clients to effectively communicate their anxiety symptoms to their prescriber. It's great if y'all discuss the medications and come up with options that seem like a good fit. But if they can't explain their symptoms clearly to the prescriber, they may not get the most effective choice. Clients often struggle to articulate whether their symptoms are emotional, physical, or both. Improving this communication can lead to more precise and effective treatment plans. It's great if you know what they mean during sessions, but they also need to be able to explain what's going on to their prescriber. And as you know, people can experience anxiety in very unique ways, but they need to have the words to translate those symptoms into something a rushed prescriber can easily understand and address. The best case scenario would involve the client keeping a log in their phone or wherever is handy, where they can track symptom intensity and duration, and triggers or patterns they've noticed. Reviewing this during sessions can also give some extra data to apply to therapeutic interventions. Ultimately, a prescriber will want to know if there are physical or emotional anxiety symptoms, or if it's a combination. It's also important to consider treatment duration. So is this a short-lived specific stressor, or are we talking about chronic, long-standing issues? This could be the difference between being prescribed a short-term PRN like Xanax or a long-term treatment like Effexor. Being well-versed in describing their symptoms enables more accurate treatment choices, which will be better for everyone. Recognizing different experience of anxiety as well as the preferred type of medications are important considerations to discuss before seeing a prescriber or making changes. There are a lot of dosing strategies out there that range from the once-in-a-while rescue medication to frequent use of PRNs or longer-term SSRIs, SNRIs, or Buspar. Plus all kinds of combinations that can go from PRNs with SSRIs or Buspar, and even all three together in some cases. So there you have it, the points to address with your anxious clients when meds are the next step in treatment. 1. Figure out what type of anxiety the client is experiencing, physical, emotional, or both. 2. How does your client feel about taking a medication as needed versus twice a day? Find out if their expectations will match up with treatment options. 3. Talk about the types of medications from PRNs, SSRIs, SNRIs, and Buspar. Details on these meds can be found in a different video. 4. Prepare your clients so that they can clearly communicate their anxiety symptoms and preferred choices to make it easy for a rushed prescriber to make a great choice, even during a very short appointment. Be sure to keep a lookout for a discussion of specific medication options and details for treating anxiety. Curious to hear more specific cases where different medication strategies were used? Stay tuned for all kinds of details. I hope your brain is calmly confident, knowing all the ways to prep your clients for the best anxiety medication outcomes. Be sure to subscribe to stay on top of helpful medication strategies that you can discuss with clients as they navigate their complicated and hopefully successful mental health treatment experience. Enjoy.